formally introduce themselves.
Well, I'll go first, my brother. Sister Marilyn Lindo, who is very, very interested in this session and looking forward for us to have a very informative session. And we are privileged to be able to have Dr. Adlam with us tonight. And I'm sure we will have a very good question and answer session. And looking forward to learn so much more about the heart. It is such a privilege, and we are extremely grateful. Thank you.
Good evening again, everyone. I am having a bit of technical challenge in terms of my video being on. Nonetheless, it is indeed a pleasure to be a part of this. Might be on some of our minds. So I trust that we will all make use of this opportunity and be blessed by it. Bless you. Over to you, Sister Latte. Over.
Unmute, Sister Deidre, not hearing you. Unmute, Sister Deidre, not hearing.
Oh, sorry about that. Thank you. All right. So as was mentioned, there will be a question and answer section, and I'm encouraging everyone to please just listen in, and where necessary, jot down your questions, and as best as possible, we will have those questions answered for you tonight. You know, I think this is really going to be a great session, and we want everyone to be able to benefit as much as is possible tonight. All right, the time may be short, but I believe that much will be accomplished. So without any further ado, it is my privilege to introduce our speaker tonight, Dr. Raquel Gordon Adlam. Attended the Queen's School. She received her Bachelor of Medicine, Bachelor of Surgery in 2008 at the University of the West Indies, Mona, Jamaica. It was always her desire to be in a position to help the sick, and being a Christian, she has always felt that ministry through helping was her way of witnessing to others. Her father died when she was 2 years old from complications of an open heart surgery. And there was this never-ending drive for her to be a physician so she could help persons that were in need. Dr. Gordon Adlam went on to pursue postgraduate studies in internal medicine for the next 4 years and completed same in June 2014. Those 4 years she would describe as the most important years of her medical career, in which her skills and clinical acumen were developed through hard work and dedication. She was actively involved in the Jamaica Medical Doctors Association. As the outreach coordinator and assistant secretary between 2009 and 2011. She was the secretary of the medical resident body between 2012 to 2014. Her training in internal medicine heightened her interest internist in the Cayman Islands after completing residency for a short time at the Cayman Islands Health Services Authority, from which she left and went on to pursue a fellowship in adult cardiology at the University of Toronto, which she completed in 2016. Being back in Jamaica, she saw the need for more interventional cardiologists as the burden of coronary artery disease was great. Interventional cardiology was always of great interest to her, and so she returned to Canada in 2018 to pursue a fellowship in interventional cardiology, which she successfully completed in June 2019 to become Jamaica's first female interventional cardiologist. During the last year of her time in Toronto, she was able to participate in the first ever intracoronary lithotripsy done in North America. This is a procedure that uses ultrasound waves to destroy calcium that would otherwise be impossible by the usual techniques. This is done so as to open a blocked vessel of the heart that is heavily calcified in an effort to restore blood supply to the muscle of the heart that is being supplied by that vessel. She is a member of the following societies. Brace yourselves: Caribbean Cardiac Society, Association of Consultant Physicians of Jamaica, American College of Physicians, American College of Cardiology, Association of Black Cardiology, Society, Society of Cardiovascular Angiography and Intervention, Canadian Cardiovascular Society, and Canadian Association of Interventional Cardiology. She is currently employed as a consultant cardiologist at the University Hospital of the West Indies and is an associate lecturer in the Department of Medicine at the University of the West Indies. Without any further ado, please help me welcome tonight our presenter, Dr. Raquel Gordon Adlam. I hand over to you, Madam.
Good evening, everyone.
Bless you. Good evening.
Thank you for that introduction, but I wanted it to stop for a while. Thank you for the invitation to allow me to speak to you guys briefly on cardiovascular health. Most importantly, health in general, as it actually ties in quite closely with cardiovascular health. And if you permit me, I would like to share my slide. So I coined a little presentation that I put together called Health is Wealth, because I really think that it is important for us to understand what this term means. And when we talk about cardiovascular health, even though for the most part we focus on the heart, there are a lot of other confounding factors that influences heart health. And so when we're thinking about cardiovascular health, we have to think about the entire well-being. So for me, and what health is described as, it's a state of complete physical, mental, and social well-being, and not just merely the absence of disease or infirmity. And this was a definition coined by the World Health Organization from 1948. And it still holds true today, as it is thought that not because you have a good cardiovascular health, or you have a good physical health, or you're able to interact socially very well, means that you are generally a healthy individual. So it's important for us to understand what health means. So mental and physical health are probably the two most frequently discussed types of health that we have to pay attention to. But we cannot underscore the importance of spiritual health, emotional and financial health, because it also contributes to our overall health. And medical experts have linked these to lower stress levels and improved mental and physical well-being. And we know that people with better financial health, and it doesn't mean that people who are wealthy, but people who know how to spend money properly, for example, may worry less about finances and have the means to buy healthier foods. And those, of course, with good spiritual health may have a feeling of calm and a good purpose, or a sense of having a purpose for living. So your spiritual health actually helps also with your mental health. A person who is good physically also have good bodily functions and usually tend to process and have their processes working at their peak. And so they can run, they can walk without being breathless, and they tend to be quite physically active. But even though you can have a good physical health, you can still have an abnormal emotional or even a mental health. So it's very important. So when you are physically healthy, you exercise, you eat normally, or what we call a balanced meal, because it's not just eating vegetables and fish and those things, but it's a well-balanced diet that is considered. And you have your heart function, your muscular function, and all of your body composition functioning normally. So when we think about looking after your physical health, it means a lot of things. It means minimizing what your hazards are at your workplace and even at home, using contraception when having intercourse, practicing effective hygiene, avoiding the use of tobacco, smoking, marijuana, alcohol, cocaine. All those things are part of abstinence, helping with your good physical health. And of course, if there are vaccines that need to be taken to prevent certain communicable diseases, then that is also considered to be a part of good health. And of course, we know that good physical health can work in tandem with mental health to improve a person's overall quality of life. Of course, if you're depressed or you have anxiety, then those things can impact how you operate or you interact socially with others, and also can affect your daily routine and adversely affect your health. So it's very important. And I think without a good mental health, which is what I think is not talked about enough, then you're physically unwell, right? So mental health has to do with your emotional, social, and psychological well-being. It is important for good physical health. It's harder to actually define mental health as opposed to physical health, because we know what physical health looks like. Mental health looks different for every single individual, right? However, with expert care and evaluation, patients can be assessed and diagnosed appropriately, and then the treatment can be implemented. And not all treatment requires medication. There can be psychotherapy, it can be counseling, and all of those things that can actually help to improve your mental health. And a good mental health helps you to enjoy life. You bounce back after difficult experiences quickly. You are able to balance different elements of life a little better than persons who have a poor mental health, such as your family life, such as your finances, and you have a feeling of safety and security, and you're able to function. And most times, if you have good mental health, you are able to achieve your full potential, especially if you put your mind to it. So having a good mental health help you to actually function really normal in society. And it is important to approach health in that regard. So factors that can affect good health, you can be born with a genetic disorder. You can have some genetic things that are acquired as you grow in life, and you have other environmental factors. Even where you're born, the community in which you live can impact your overall good health. If you are born in for example, an underdeveloped country like Jamaica is, some people are actually in areas that there is no proper running water, there's no proper disposal of garbage. Those things can affect your health and your physical well-being. And so it's important to understand that your environment plays a role in how you develop and in your overall wealth and health. So where a person lives can affect their health, the state of the surrounding, the genetics, their income, their level of education, and of course their employment status. And I'm going to scroll forward to go directly to cardiovascular health, because that's where I want to focus on a little bit tonight. So cardiovascular health refers to the health of the heart and the blood vessels. Okay, so when somebody comes to me, for example, and say, "Oh, doc, I was told that I have heart disease," that is a very broad statement, because the heart is made up of blood vessels, it's made up of heart muscles, it's made up of electricity. And so what aspect of the heart that is affected helps to come to the actual diagnosis of the heart disease. Okay, so cardiovascular disease is a group of disease of the heart and the blood vessels, and these include coronary heart disease, or what we call coronary artery disease, meaning a blockage of a blood vessel of the heart. It can also be as a result of a stroke, because a stroke is really about the blockage of a blood vessel or a bleeding of a blood vessel. Heart failure, where the heart is not pumping very well, either it's actually weak or it's not relaxing very well. You can have arrhythmias, which are irregular beating of the heart. It can be fast irregular or fast regular, but the rhythm of the heart is not normal. And of course, you can have heart valve problems. So there's a lot of things that make up the umbrella of heart or cardiovascular disease, right? There are several risk factors that lead to the development of cardiovascular disease, and these include high blood pressure, high cholesterol, diabetes, smoking, whether it be tobacco or marijuana or a cigarette. There can be also risk factors such as rheumatoid arthritis or any form of inflammatory disorder. Anything that predisposes you to clotting can also cause you to develop cardiovascular disease. Some cardiovascular disease you are born with. Some patients are born with a narrowed valve. Some patients get an infection on the heart valve that causes it to get narrowed, or can cause it to actually break off or shear away, and it actually causes the valve to malfunction and not open and close properly, and that can cause the blood flow to be impaired, causing what we call a regurgitation, or we call it a backflow of blood, because blood is usually supposed to flow one way in the heart. So if blood is going one way and some of the blood, instead of going in the one direction, is backflowing, then that is also abnormal, and we see that a lot, right? Now, when we think about cardiovascular disease, for me as an interventional cardiologist, the first thing that comes to mind is a heart attack, okay? A heart attack is caused by a blockage of a blood vessel of the heart, right? And when you have that blockage of the blood vessel of the heart, then the heart muscle becomes starved of oxygen and blood. And when that happens, the starvation starts presents itself as chest pain. And some people may have shortness of breath. Some people may feel dizzy. Some people may start to sweat profusely. Some people may feel nauseous. There are different presentations. So not everyone who has a heart attack will end up with severe crushing chest pain that tells you that this is a heart attack. There are varying presentations of same. And now what we are seeing is that cardiovascular disease remains the leading cause of death worldwide. Jamaica is no exception. And whereas I used to tell people that usually in your 50s and 60s, that's when you get heart disease, and that's when you're at highest risk for having heart attack and stroke, that age group has been dropping and dropping, lowering each year. My youngest patient who has had a heart attack was 26 years old. And that is frightening. So it's either we are doing something differently or our environment is changing. And so if our environment is changing and we're doing something different, then it means that we as individuals now need to do something different to prevent that risk of developing a heart attack or a stroke or any form of heart disease, right? Now, there are things that we can do to prevent a heart attack or to lower our risk of getting a heart attack, and there are things that we have no control over. So what we call those things that we have no control over are the non-modifiable risk factors. So we can't modify our sex contrary to popular belief. We can't modify our age. We can't modify our genetic predisposition. So if your mother or father has a strong history of developing high blood pressure, diabetes, or high cholesterol, you have that similar risk of developing same, right? And so screening for you should start at least 5 to 10 years younger than your parents were diagnosed. And screening helps you to understand how to manage your illness so that you can prevent the long-term complications, right? So we can't change age, we can't change sex, we can't change gender, we can't change our ethnicity, and those are also predictors. So a 60-year-old man is at greater risk for having a heart attack than the same 60-year-old woman. An Indian or what we call Southeast Asian individual is at a greater risk for developing a heart attack than a Black person. Those are the things. Diabetics, those are some of these things are what we call lifestyle. There are countries in the world that have very low incidence of high blood pressure because they consume little to no salt. And that is something that we as Jamaicans, we are very, very, very bad at eating in terms of we love our meals to be prepared with lots of salt. We don't like fresh food, as we would call it. And those things are not good for us. So high blood pressure is something that we can modify. Diabetes is something that we can modify. We don't have to smoke, right? We can actually live a healthier lifestyle. We can exercise, and we can avoid the foods that are not good for us. So how do we tend to lower our risk for having heart disease or developing a heart attack? We eat healthy, we exercise, we try to control our blood pressure if we already have developed high blood pressure. We try to control our diabetes if we have already developed it. We try to control our cholesterol if we have developed it. We are not saying that for everybody with high blood pressure that you need to be on medication. Absolutely not. There are patients who are pretty well controlled of medication, but it requires strict lifestyle modification, including your diet and exercise, to actually control some of these lifestyle diseases of medication. And once you're able to do that, there's no doctor that will tell you that you need to be on medication for these things to be controlled, right? Now, how do you tell if you are at risk for having a heart attack? If you have any of the things that I mentioned. If you have high blood pressure, diabetes, high cholesterol, you're a smoker, your mother or your father, or any first degree relative has had a heart attack or a stroke, you are at risk of having a heart attack or a stroke. If you are at risk for having those things, now you need to know, try and practice a healthy lifestyle, but also try to reduce your risk of having those events. And how you do that? If you get medication, you should take it. You should monitor your pressures. You should not be a diabetic and not have a glucometer reading machine at home, right? You should not be hypertensive and not have a blood pressure machine at home. It is not acceptable for you to have high blood pressure and you have no clue if your medications that you're taking is working. Most medications are not one size fits all, and so what will work for Raquel may not work for Nareen. And so Nareen may need something different from Raquel, because that will help her to control her pressures, and what Raquel is taking will not control Nareen's pressure. So it's very important. Of course, smoking is not just you smoking, but if you're exposed to second-hand smoking, that is also of similar risk as if you were smoking yourself. So it's very important that you understand that other things that you may do as an individual may also affect someone else. How do I know that I'm getting a heart attack? So if you're having any form of chest pain that is worsening on exertion, so if you're walking and the pain gets worse every time you move, that is a cause for concern. If you're walking and you get short of breath every time you move, then that is also a cause for concern. If you're having chest pain that is lasting for at least 20 minutes, that is associated with shortness of breath, heart racing, nausea, bad feelings, or any form of ill health, then that is a cause for concern. If you are having any form of chest pain that goes beyond half an hour, constant, not going away, aggravated by any form of movement, you should go to the nearest emergency room and not to a private doctor. Not to a GP office, not to a private doctor. You should go to the nearest emergency room. If you go to an emergency room and they don't have an ECG available, find another emergency room. Because it's very important, a lot of times, delay in the diagnosis of a heart attack also affects the outcome of the patient. And so it's important. Now, what can I do to reduce my risk? As I said, exercise, eat right, take your medication if you are on medication, and try to live a healthy lifestyle. What can you do to your surrounding? You encourage each other to actually eat better, exercise, do group exercise if that helps a lot. If you're in a community that is safe and you can walk for at least half an hour a day, 5 days a week, that is known to actually improve cardiovascular health. Now, sometimes there are warning signs before a heart attack. So you can be having a chest pain coming and going, and you're not sure what it is. You should always check it out. You can be having shortness of breath. You can feel the heart racing. You can feel dizzy. All of those things you should not take for granted. And I will stop here and I will entertain any questions that you may have in relation to heart disease.
Thank you so much, Dr. Gordon Adlam. while persons are gathering their questions, the first question that I would like to ask, in looking on heart health, I saw a statement that said a healthy heart can prevent high or low blood sugar. How true is that statement?
Can you repeat your statement, please?
It says a healthy heart can prevent high or low blood sugar.
I don't think that is.
So I'm wondering.
I don't think that is totally accurate, right?
Okay.
Your heart, your blood sugar is metabolized in your liver, right? If you are diabetic, right? Diabetes can affect your blood vessel. It makes it sticky, and it increases the risk of the plaque or the cholesterol plaque depositing on the blood vessel. But the diabetes itself, right, is the problem that affects the blood vessel, not the other way around. So you can have, so yes, once you're diabetic, your risk of developing a heart issue is greater, but not the other way around.
Okay, all right. Thank you. One other question. Go ahead, Minister. I think you're...
Okay, if I may, Dr. Adlam, you would have touched on some essential pointers, mental health, physical health, and these are some of the things that sometimes we take for granted. As you probably can appreciate, you know, a lot of Jamaicans visiting the doctor is not something that they have as priority. And with the factors that you would have indicated, the genetic factors, you know, there are persons who it might be hereditary, as you would have alluded to, and they are not aware that this condition runs in the family. What may happen sometimes is that persons may have these kind of discomfort and they may just write it off as gas, as a lot of Jamaicans will say. You know, I'm experiencing gas pain because my eating schedule was disrupted or something. But the difference, can you help us to understand the difference between angina and a heart attack?
Okay. Just in reference to your gas pain, just to point out that I've treated many heart attacks that people were treating at home as gas pain. That's one. And there's no way to tell the difference between gas pain or if you are having a heart attack. So I tend to not want to hear the word gas pain at all. Now, yes, you can have gas pain, right? But if you're having a pain that is not relieved by the usual gas medicine, right? Then you should not continue to nurse it as gas pain, okay? So you can try your home remedies, and if it's really not helping, do not persistently blame it on gas pain. Now, your question about angina and a heart attack. Angina is the precursor to a heart attack. So angina is where the blood vessel is blocked and the heart muscle is being starved of oxygen. So angina is referred to the chest pain that you get because the heart muscle is crying out for blood, okay, and oxygen. When the heart muscle starts to die, that is when you get the heart attack. So angina is where the heart muscle is being starved, and if it is not fed, then you get the heart attack. So the death of the tissue or the death of the heart muscle is a heart attack. So that's the only difference. And that's why we treat unstable angina the exact same way we treat a heart attack. Because if it is left untreated, you end up with a heart attack.
Okay, thank you for that. Just a follow-up question. The persons who you alluded to the buildup of calcium, or if I'm correct, fatty deposits that will actually block the arteries. One of the things that persons will do in home remedies or in trying to alleviate the discomfort that they have is that persons will tend to take unprescribed medication, specifically aspirin. Can you just shed some light on that practice?
So aspirin for the treatment of angina is absolutely essential. But the aspirin is not the problem. Most, if not all of our patients, unless you are allergic to aspirin, will be on aspirin if you've had a heart attack or a stroke, or if you are deemed to have angina, especially unstable angina, you will be on aspirin. So if you're having a chest pain that is unusual, that you think may be concerning for the heart, we recommend that you chew an aspirin. But this is you chewing the aspirin en route to the hospital. Okay? This is not you chewing the aspirin today and going to your bed, and then tomorrow the pain comes back, you chew the aspirin again and go to your bed. Right? As you mentioned aspirin, I must mention that there are some pain medications that are detrimental to you if you take them for treatment of chest pain that is related to a heart attack. And these medications are called NSAIDs, non-steroidal anti-inflammatory medications that are given out like water, right? I'm sure almost all of us know about Brufen or Aleve or Advil or Cataflam or Voltaren. These are medications that cardiologists like myself avoid like the plague. They actually increase your risk for having heart attack and stroke. Because even though aspirin is an NSAID-like drug, they do not break down the same way, and based on the pathophysiology of their metabolic products, they increase your risk for heart attack and stroke. So for diabetics or persons with high blood pressure that are at higher risk for developing heart attack and stroke, if they're having pain, I do not prescribe anything that is called NSAIDs, okay? So I do not prescribe Cataflam, I do not prescribe Voltaren to any of those patients. Am I saying that those medications are bad? They are bad for you. They are not bad medications. They are bad for you who are at risk for having heart attack and stroke.
Okay, thank you for that, Doc. You said the persons who are on aspirin, that alludes to the fact that it would have been prescribed by a doctor and being taken in a particular regime, not just persons deciding to take an aspirin or two aspirin every day because they may believe that they have a condition and they just are fearful of visiting the doctor because correct me if I'm wrong, aspirin is in fact a blood thinner. And if it's not taken as prescribed but just taken consistently every day, then there are some risks to that person.
So aspirin is not really considered a true blood thinner. Aspirin is an antiplatelet medication, okay? There are medications that we actually call anticoagulant or blood thinners. Aspirin is not one of those, okay? So aspirin is an antiplatelet, so it prevents the platelets from coming together, and that is why your risk of bleeding is greater, but it doesn't make it a blood thinner, right? Aspirin, when taken, reduces the risk for blood clot formation because the platelets don't come together. That is the purpose of the aspirin. So aspirin, though it should be prescribed by a physician, it is not a bad drug, especially for cardiologists we use aspirin on a regular basis. And for that reason, but it's not something that should be self-prescribed. If a patient thinks that they are at risk for heart attack or stroke, then they should be seen by a cardiologist. And then if the aspirin is deemed necessary, then they will be started on it. But I am not advocating for anyone to self-medicate with aspirin, because there are special indications for aspirin. The guideline dictates that if you're over 40 and is diabetic, then you should be on an aspirin. If you're over 50 and you have high blood pressure, you should be on aspirin, because it definitely has been shown to reduce your risk for developing stroke and heart attack.
Yeah. Anyone else? Go ahead.
Yeah, somebody else.
All right, so as you mentioned, the diabetes and so on. So my daughter was diagnosed with diabetes at age 9. And based on the diagnosis, is it that you recommend that it is needful for her to be on some, I don't want to say regimen where aspirin is concerned, but it would be helpful in her,
No.
with her current condition?
So there are two types of diabetes, type 1 and type 2. I assume that your daughter would have been diagnosed with type 1 diabetes at her age, right? Which is insulin dependent.
She's insulin dependent.
Insulin dependent diabetes, right? Now,
right.
As I said before, the guideline recommend aspirin at those age. You are not expected to develop atherosclerotic disease, right? You're not expected to develop plaques in your arteries, right? But the guideline does not recommend aspirin use before the age of 40, even if you have diabetes before the age of 40, right? Because that is when the risk of atherosclerotic disease and the complication becomes greater. Now, that being said, because she has diabetes longer, her process of accelerated atherosclerosis will be greater, okay? So it means that the diabetes control in these periods at this time is of utmost importance. The better the control, the slower the progression to any form of complication.
Okay. In terms of the heart disease, and this is my final question to allow Sister Linda to ask her questions. When it comes to having a heart monitor, and I'm asking this on account of my son-in-law, he has a heart monitor, but he also has seizures, which occurs from time to time. But based on the heart monitor that he has, oftentimes it prevents him from being able to access certain kinds of tests that would be able to better identify solutions with regards to the seizures that he has. Is there any recommendation, or is there any way that after inserting a heart monitor, that it can at any time be removed, or once it's inserted, if it's removed, there are going to be other complications?
So you mentioned heart monitor. Heart monitor is very broad. Are you making reference to a pacemaker? Or your
pacemaker, right?
Okay. So you're making reference to a pacemaker. And if the pacemaker was put in the last 10 years or so, most pacemakers are MRI compatible. So it really should not prevent him from having evaluation for a seizure. In fact, a seizure, one of the most sensitive tests for seizure evaluation is what we call an EEG, or an electroencephalogram, right? And that is where they put monitors over the head, and they literally monitor the electrical activity of the brain. That will not affect or a pacemaker being inside you will not affect an EEG being done. A pacemaker inside you will not affect MRI of the brain being done. So I'm not so sure why that is so, but that is not the case. So
I think he may have practicing longer than
most devices are MRI compatible, and it can be easily ascertained if his device is MRI compatible. But even so, an EEG can be done. It does not need that EEG will not affect the pacemaker, or the pacemaker will not affect the EEG.
Okay. All right. Thank you.
Okay.
Doc, I think we're getting a little bit under time. So with the other members in the chat room, if they can ask questions. Is there any questions coming up for the doctor from the chat room, please?
Okay, so blessings, Dr. Gordon, Adlam. So my question is, if you have heavy menstrual bleeding monthly, does that affect, or can that affect your heart condition in any way?
So if you have menorrhagia, you can get anemic, and if your blood count is low, what it can actually do is cause a high output state, and with that high output state, you can actually go into heart failure if your blood count is low. So in a roundabout way, if your hemoglobin drops or your blood count drops because of your significant menorrhagia, it can affect the function of your heart.
And would that also come with like chest pains?
Yes, it can.
Okay. Thank you.
No problem.
Any question from any of the participants?
Good night.
Good night.
Hello?
Go ahead, Sister Paul.
Yes, good night, Doc. Is muscle contraction of the muscles, especially in the legs, is it has it any relation to the heart?
Not usually. Muscle contraction of the leg. So let me paraphrase that.
Okay.
Sometimes it can be muscle contraction can be confused by what we call claudication. Okay? Claudication refers to you start walking, and in about 100 meters, you start to have leg pain that may be confused as muscle contraction. Okay? Claudication refers specifically to basically impaired blood flow to your legs. And it is the similar way its claudication is basically angina of the foot. And so if you're having leg pain specifically related to walking and at particular distances, you know that there's severe leg pain, then that is not muscle contraction. But muscle contraction really refers to an impairment in your electrolytes, calcium, magnesium. They actually come in and out of your muscle cells to actually cause normal functioning. Any impairment in your calcium, your magnesium, your sodium, basically your electrolyte, can increase your risk of having muscle contraction. But some people may mix that up with what we call claudication. And claudication is that just like how you have blockage of a blood vessel of the heart, you can have blockage of the blood vessel of the foot.
Yes.
Okay. Thank you very much.
You're welcome.
Anyone else?
Doc, there's a tachycardiac. That's what is exactly the reason or the effect of tachycardia on the heart muscles, or what causes it?
Tachycardia is a broad term for your heart beating fast. It can be normal fast, and it can be abnormal fast, okay? Tachycardia refers to your heart rate going above 100. For the most part, there are myriads, a long list of arrhythmias, or what we call an irregular beating of the heart, that can cause the heart to go fast or beat fast. Your heart is wired just like how you wire a building. You have a breaker system, which is called a sinus node, just like how you have a breaker system in your house. When there's a short circuit and you have an electrical output or you have an electrical outage, then it's a similar thing that can happen to cause the electricity of the heart to start firing abnormally. So there's an electrical shortage and there's an abnormal firing along the electrical cords that are in your heart. And so that affects the heart pumping, because the faster it drives the electricity, the faster the heart have to pump. The faster the heart has to pump, the less time it has for filling. So the less time the heart has for filling, the less blood that will go to your brain, the less blood that will go to your body, your rest of your organs. And over time, if that is not fixed or adapted or changed, right, then the heart will start to get weaker and weaker because it's in overdrive. And so the heart muscle will get weaker and weaker
as the tachycardia or the fast heart rate continues. So for most patients, if you're in an abnormally fast rhythm for greater than 24 hours, you're gonna start going into heart failure, because the heart is not able to beat uncontrollably for 24 hours without any repercussion, because impaired filling will always affect how the heart functions.
Okay.
What
Elaine,
would trigger? Excuse me. What would trigger what in the heart would trigger it?
It can happen because of scarring as you get older, just like how an old building short circuit is the same thing, your old heart short circuit.
Okay, thank you.
No problem.
Elaine Russell has a question.
Greetings, everyone. I have 3 questions. What are the signs in terms of chest pain? How do you decide when to visit the doctor just in case it might be a heart pain in the chest?
I said it earlier. So if you're having chest pain lasting for hours, that is constant, or lasting for more than half an hour, that is worsened when you move around, that is associated with shortness of breath, or you feel nauseous, or you have bad feelings, that is not relieved by your usual remedies, that you feel you're sweating more than usual, you feel extremely fatigued or extremely tired, then that should be a cause for concern that requires you to visit the emergency room.
Okay.
If you feel like the heart is racing with it, and if you feel like you're going to pass out, all of those things should tell you that you need to go to the emergency room.
Okay. As it relates to circulation in the foot, because that has to do with the heart, how would one know if there's a cramp or a pain in the leg or the foot is related to the heart?
Sometimes it is hard to tell, but it's how it is brought on, okay? If you notice that it is reproducible in terms of the distance, right, that you walk for it to come on, that is usually a sign. If there's associated prolonged pain, if you have to rest for that pain to go away, if it is not the actual muscle contracting, because you know sometimes when the muscle contract, the muscle is actually very stiff. Those are some of the signs that it could be. And when I think a lot of people confuse the term poor circulation. When a general practitioner uses the term poor circulation, that's not what I'm referring to. So when a general practitioner uses the term poor circulation, it means that the leg veins and not the arteries, the venous system of your legs are not flowing properly. That is what poor circulation means. It means every vein, you have veins and arteries. Your veins have valves in them that actually allow for what we call linear flow or normal flow. When the valves become incompetent, then that flow is disturbed. That is what is meant by the actual real term of poor circulation. Now, when we are talking about atherosclerotic disease or cardiovascular disease, and we're talking about peripheral arterial disease, that is something totally different from poor venous circulation. So the claudication, which I mentioned, where you have the angina of the foot, is caused by the blockage of the blood vessel. And that is how a lot of diabetic lose their limbs, not because of poor circulation, but because of the same thing that happens in the blood vessel of the heart or the brain, is the same thing that happens in the blood vessel of the leg, and the heart, the muscle in the leg starts to die, and then it actually end up causing you to lose your limb. That is the same process that happens. So if you notice that the legs are getting darker than your usual complexion, if you notice that the legs are swollen or you're having pain in the legs, or even if a piece of cloth passes your leg and it actually feels like there's fire there, you need to check it out. One, it could be nerves. One, it could be your veins. And two and three, it could be your arterial supply.
Okay, so
And
for
one
persons
other
like
thing is
me,
the loss of hair in the legs. If you notice that your hair, without shaving, you're losing your hair, the legs are becoming more shiny and taut, then that is also a sign that there may be some impairment in blood flow, whether it be whether it be the vein or the artery.
okay, so persons like me who do a sitting down job should be, what advice would you give me to help prevent poor circulation?
Cock
Get
up
up
your legs
again.
when you're sitting down.
Repeat?
Cock up your legs and compression stockings. Keep your legs up. Keep your legs up
Oh,
and compression stockings.
okay. All right, the last question, your pulse. Can your pulse give you a sign that you have a heart issue?
Yes. It depends on the heart issue. But yes, your pulse can give you a sign. Your pulse can be too low, it can be too high, it can be irregular. And those are signs that the heart cannot be working properly. So if your pulse rate is below 50, that's usually something to look out for, especially if you're having dizziness with it or you're feeling extremely fatigued. That is a sign that the heart rhythm may be abnormal and you may require a pacemaker. If the pulse is a little going above 100, persistently above 120, 130s, then that is also a sign that there's something may be wrong with the heart, whether it be the heart electricity or the structure of the heart or the function of the heart, that is a sign.
Okay.
All
All right, I
right.
know I said three. All right, I know I
Sorry, go
said
ahead.
three questions. You're right. I know I said three questions, but because I answered the question about the pulse, I always notice when I do my checks with the nurse, they normally check for the oxygen level. If your oxygen level is below 95 or 94, could that be heart related as well?
No.
Okay.
Oxygen saturation between 92 to 100 is quite all right.
Okay. All right. Thank you much.
All
You're
right,
welcome.
Dr. Adlam. I think this might be the last question before we wrap. You spoke of the risk factors, and without a doubt, the high blood pressure, cholesterol, etc., diabetes are crucial to control. But can you shed a bit of light on oral health as it relates to heart conditions, persons who may have severe gingivitis, etc. Can you just shed a bit of light on that, please? And I think that's the last question.
So your oral health can affect your heart in terms of your risk of developing heart valve infection, okay? And when you develop, so if you have an infection if you have a lot of dental caries or cavities or gum disease, when you eat or whatever, the bacterial flora or fauna in your mouth goes down into your body. And if it goes and affects your heart, then you can develop what we call infective endocarditis, right? In endocarditis, meaning it can affect the valve or the lining of the inside of the heart. If that happens, then the valve can start to malfunction and you can go into heart failure. Now, if the valve starts to malfunction, meaning it cannot close properly because there's a vegetation, meaning an infective piece of material that is now lodging on the valve. And if that is not taken off, whether it be with antibiotics or with surgery, depending on the size, because if it's a large vegetation, then it needs surgery to be removed. And you have to be treated for at least 6 weeks with antibiotics to get rid of the infection on the heart valve. But that can also predispose you to developing heart failure. So yes, your oral health does contribute to your entire heart health as well.
All right, thank you for that, Sister Latipowell. Over to you to wrap.
All right. Thank you, Minister. Thank you so much, Dr. Adlam. I believe you gave a wealth of knowledge in a short time. I know that persons might just be getting started in terms of the questions, coming to light. And I know we have already gone past the time. So I'm just going to have, or ask rather, Evangelist Dennis to do the vote of thanks, as we really appreciate the effort that you have made to be here, and we want to ensure that you know that we appreciate you.
Thank you so much, Sister Deidre, and other moderators, Mr. Thompson, Sister Lindo, Dr. Gordon. Thank you so very much, Gordon Adlam. And I can get a little bit more, what would I say? Friendly. We're family. Thank you so much, my niece.
No problem.
It was really, really, really a pleasure to have had you sharing with us tonight. We have gained so much, as Sister Deidre said, so much in such a short time. And we really appreciate you taking the time out to do this for us. And we just wish you all the very best going forward. There's just one question I wanted to clarify for me, for our younger viewers or listeners, participants. Can you just explain what an interventional cardiologist does?
Okay, an interventional cardiologist is where we perform interventions in the heart. So if you're having a heart attack, I can go in and we can open up a blockage that is causing the heart attack by putting in stents. We can go inside the heart and we can open up valves that are tight. We can put in pacemakers. We can do what we call ablation. So there are lots of different stuff. We can fix valves, put in stents, plug holes in the heart, and we can fix the abnormal electricity of the heart.
Thank you so very much for that. And I specifically asked because I know of at least 2 of our youngsters now who are preparing to go into university and they want to go in the medical field. So in case they're interested, I'm sure that you would not have a problem if I need to link them with you, for further information. And so just on behalf of everybody on Facebook, those on YouTube, thank you so very much again. God bless you. And enjoy the rest of your night and have a blessed rest of the week. All right. And I speak on behalf of our pastor. He was online, a little bit busy in and out. And so I speak on his behalf too. Thank you so very much. God
You're
bless you. And we'll be calling on you again.
welcome. All right, no problem.
God bless. Thank you. All right,
Bye-bye.
Sister Deidre.
All right. Blessings to each and every one of you. It really was a pleasure having you tonight. I'm sure that you may have garnered some information that will help you in preventing or working to prevent any possible heart conditions that could develop as a result of the different factors that can affect our heart health. A lot was listed, specific reference to genetics, your environment, your educational background or you know levels, amongst other things. And it is critical that we ensure that our mental, physical, spiritual, psychological, all this wellness, complete wellness, is important to maintaining good heart health. All right. So thank you so much to everyone, those joining on YouTube, Facebook, and via Zoom. Your participation, your attendance is greatly appreciated. Please enjoy the rest of your weekend. If there are any questions that you didn't get to ask tonight, you can always forward them to Evangelist Dennis. And where possible, I believe she will be able to make the link with Dr. Adlam in order to get some of those questions answered for you. And I'm taking the liberty of saying that. I hope I'm not wrong. But thank you so much for joining tonight. God bless you all. Do enjoy the rest of your evening.
Thank you. And I'm going to share on screen, as you have rightly said, for follow-up. So